Good morning, Peter Goertz. I'm a psychiatrist. After a suicide attempt, does a person always need psychiatric hospitalization? In my opinion, the short answer is yes. They may need medical hospitalization first, even in an ICU, perhaps. What brought this up in my mind is I had a patient and the patient did not want to be psychiatrically hospitalized after a suicide attempt. The family member that was with the patient also did not want the patient to be hospitalized psychiatrically. I felt strongly that the patient needed to be hospitalized, and that can create a feeling potentially in the psychiatrist. That type of situation can create the feeling of pressure from the family. And the family may also put pressure on the emergency room doctor, so that doctor may feel pressured, may pressure you, the psychiatrist, also. So bottom line, you want to stand up for yourself. Easy to say sometimes. And if not, though, if you don't stand up for yourself, you may potentially have some trouble sleeping the next night, or the next day think, oh my God, how's this patient doing? Is she still alive? He's still alive? So it's important to try your best to get comfortable with making unpopular decisions and being able to cope with those decisions and, if necessary, restate your opinion towards the ER doctor, towards the family, the patient. A patient I had many years ago on an inpatient psychiatric ward had made a serious suicide attempt, and he was on a one-to-one suicide watch. And the nurse, the head nurse, whom I was very friendly with, said that morning, Peter, we're really short-staffed. Can we take him off suicide watch? And I thought, but I think partly because I liked her, we were friends, I said, okay, and I put in the order. Unfortunately, the patient, within maybe an hour or two, tried to hang himself on the ward and died a week later. So that type of thing is a wake-up call. We really do need to stand up for ourselves if we feel strongly about a decision. For example, what I've talked about, decision regarding hospitalization after a suicide attempt. And the family may say, we're going to watch the patient, we're going to watch her or him 24 hours a day, we'll take responsibility. It's not the family's job. They can't really take responsibility because they're going to have to sleep sometimes. So again, you want to listen to them, but also consider your own judgment. The intention at the time of the suicide attempt or possible suicide attempt is crucial. So if someone intended to kill themselves, that's really a red flag. Did they want to die? Important to know. The lethality of the attempt is important to know. Was it a gun? Was the patient depressed? Were they using drugs? And with drugs, for example, IV heroin, it can be a gray area. Unless the person knows their supplier well and the supplier is reliable, they probably don't know what the concentration of heroin in what they're injecting is. And sometimes, based on what I've heard from talking with patients over the years, sometimes the patients just don't care whether they wake up or not. So they inject the heroin not really knowing if it's what strength the heroin has, and not necessarily caring if they wake up or not. A sad, sad situation. Collateral information is key. It's really important to talk with the patient's family, even maybe a neighbor. So I recently had another situation where the family member did not know anything about suicidal ideation in the patient, but the neighbor sure did. The patient had told the neighbor very clearly what she wanted to do. So try your best to get as much collateral information as you need. And even if someone, there's so many tricky aspects to this, even if someone does not really want to die, they can still die from an overdose, let's say. I had a patient who wanted to be admitted to the hospital years ago. I was in the emergency room. He wanted to be admitted to the psychiatric ward. And the interview went well. We talked in a relaxed way. Until I mentioned the word shelter, I did not think he needed to be admitted. He just got up, took his whole bottle of medicine, ingested it right in front of me. The security guard could not get to him soon enough, so he ingested it, ended up in the medical ICU. So it seems pretty clear that a patient like that did not 100% want to kill himself because he did it right in front of people. He overdosed. On the other hand, he could have died. So a lot of tricky aspects, important topic to think about. Thank you.